Traditional healthcare was never built for reversing chronic disease. It was never built to keep your health optimal. It was never built for you to be empowered with your own data. Everyone should be going to a clinic like Next Health to make sure that they understand what is their current status of health and what's the trajectory. You see these concepts thriving because people finally feel like they have something else that relieves them of that frustration that they've had with Western medicine for decades now.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Dr. Darshan Shah, founder and CEO of Next Health. In this episode, we talk about building a national network of longevity clinics. Dr. Shah explains how his experience in traditional medicine led him to combine lifestyle, functional, preventative, and longevity medicine under one roof. Plus, we discuss franchising the business, personalizing care, and helping more people feel better and live longer. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive, preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Darshan. Welcome to Fitt Insider. Thanks for joining us.
Joe, such a pleasure and honor to be here. Thanks for having me.
Excited for today's conversation. And just to kick things off, why don't you introduce yourself, tell us about Next Health, and then we'll get into it.
Yeah, my name is Dr. Darshan Shah. I'm a physician, been one for 30 years now. I can't believe I'm saying that. But Next Health is the company that I formed 10 years ago when I saw a need in the health and wellness space. And we're scaling Next Health now we'll have 20 locations by the end of this year, and we have 150 locations planned.
Wow. And 10 years, quite the kind of build up to this point, really getting into expansion mode. And I think now, I mean, you were ahead of this curve, but just seeing what's happening from diagnostics to therapeutics, optimization to just everything that fits into this, if we're calling it wellness or preventative health or longevity. Yeah. What all can people expect at clinics? How do you think about the space and offerings and what all that entails?
Yeah. So, you said something really interesting is like, we started Next Health. No one knew what the hell we were doing. It was like, what is a longevity clinic? And what does that even mean? And does insurance cover this? And I don't want to live to be 120 anyway. So why would I come here? And 10 years ago, and we were West Hollywood, where you think like, everyone would kind of have some inkling about what we were trying to do. But we spent a lot of time explaining the mission of Next Health, which is really to help people reverse chronic disease, avoid chronic disease, empower them with their own health data so they know what trajectory they're headed in, and also to bring people the latest technology and thought in medicine around longevity. And we struggled for many years telling the story, but we ended up finally getting a nice client base and expanding to 3 locations in Los Angeles. And then the pandemic happened, and the pandemic's almost completely shut us down because we were told to shut down our stores. We're a 4-wall business. We're not an internet-based business, right? And so when we had to rejigger our thought process around how do we keep the business alive during the pandemic. So we came out of the pandemic, and by then everyone was listening to Huberman and Peter Attia and just kind of really got their heads wrapped around just staying healthy and preventative health in this space of biohacking, which a lot of people dove into as well. So the reason I bring all that up is because through that 10-year journey, what Next Health really has become is a combination of 4 verticals in healthcare. Those 4 verticals are, number 1, lifestyle medicine. This is all the stuff that we talk about, getting the basics right around nutrition, sleep, exercise, stress management. Vertical 2 is functional medicine. These are the topics like gut health, hormonal health, environmental detoxification, et cetera, et cetera. Thirdly, preventative medicine. This is the medicine 3.0 stuff that Dr. Peter Attia talks about. How do we not die from cardiovascular disease, Alzheimer's disease, cancer? And lastly, longevity medicine, which I clump together topics like peptides and regenerative therapeutics like exosomes, stem cells, plasma exchange. And when you put all 4 of these modalities under one roof, and you bring these technologies under one roof, under the clinical practice of medicine, I'm a physician, MD, it's all under my license. You have something really special. You have a place, a one-stop shop where people can go to experience all of this in a unified model that makes sense. So people aren't trying to piece it together from different places, different doctors, different practitioners. And that's the secret magic sauce of what we're building at Next Health. And, I think people are really liking it. We're seeing hundreds of new members every week, and we're expanding, like I said, to 30 locations in the next 365 days. And hopefully, we grow beyond that.
A lot of the things that you mentioned, just the concept of prevention and longevity coming into kind of mainstream zeitgeist, whether that's podcasters or, other folks helping drive that. Certainly not just podcasters, but professionals, scientists, researchers in their own right. And then really this dissatisfaction, distrust with traditional healthcare, like people feeling like they're not getting what they need or want out of it. And when you think about this model, and there are a couple of different concepts, some totally physical, some digital, some, come in a la carte, some memberships. How are you putting it together to, in your case, feel like you're giving people access to these pillars and the experience that really does move the needle and help them reach the kind of goals and well-being that they're striving for?
When we talk about traditional healthcare and people being frustrated with it, it's because traditional healthcare was never built for reversing chronic disease. It was never built to keep your health optimal. It was never built for you to be empowered with your own data, right? It was built for if you get hit by a bus or if you have a heart attack or you get diagnosed with cancer. That's what it's great at. And I think this kind of decoupling of creating a brand new system around health and around disease prevention, utilizing these advanced technologies is the way of the future. I think that we need a whole new system of clinics that does this, and then the Western medical system does that, right? And when you think about it that way, you need both, right? And so I think, like you mentioned, there's digital platforms, there's other four-wall concepts. I think we need 1,000 of these clinics in every city because everyone should be going to a clinic like Next Health to make sure that they understand what is their current status of health and what's the trajectory so we can make sure that you never need to use Western medicine unless there's an emergency situation. And I think there's a massive opportunity in this space, not just for Nextel, but for multiple other concepts to come about and really do well. And we see that, like you see Function Health thriving. You see these concepts thriving because people finally feel like they have something else that relieves them of that frustration that they've had with Western medicine for decades now.
And in your case, is that a membership model? Is that you can come in and kind of pick and choose the services? How do you think about delivering this and the way that you want to structure the clinic?
Yeah, so we really want to partner with our patients on a journey of reversing chronic disease, keeping their health optimal. The side effect of that, I always say, is you feel incredible. So we want to partner with people until they feel incredible, right? And that's a journey that's not like a one-off purchase thing, right? Health is not something that you can just step into, get an injection, all of a sudden you're healthy. So we have a membership model. And that membership model, we have different tiers of it that gives you access to different services at different tiers, but is generally a journey that involves visits with our medical practitioners on site on a frequent basis, access to testing, access to the technologies that we all know work, and we curate everything for them using medical practitioners.
There's kind of so many pieces of this when you think about layering diagnostics, therapeutics, optimization, and really then when you drill down into it, like obviously everybody now it's become a buzzword, but truly for it to really work the way it's intended, like you want it to be all personalized, right? So how are we personalizing these protocols, whether it's things like IV therapy or hormone optimization, peptides, like all those things that go into it. What does that kind of member experience look like? How do you get to that level of personalization and then continue to, drive progress?
Yeah, Joe, one of my mantras is we practice N of one medicine. And, that's the title of my book, actually, that's going to be coming out in about a year is the N of one. And the reason we say that is because we recognize that every individual has their own individual biology, and we need to customize everything we do for the individual. That involves a few different aspects to it. Number one, obviously, is testing your biomarkers and seeing where you're at with your blood tests, urine, genetics. We do stool testing. We do we do a lot of testing to understand where you're at. And then when we put therapeutics into place, we understand that these therapeutics can have an outsized good effect or even a negative effect on you. And so we're monitoring your biomarkers to see what therapies are affecting you positively versus not at all versus negatively, because you don't want to waste your time either if it's not helping you, right? And so it's a core part of our process. That's why we check biomarkers quarterly on our patients, and we're always running little mini experiments. So we're big fans of continuous glucose monitors, wearable monitors as well. And when you think of it that way, and a lot of people, you're probably already doing this, a lot of people are already doing this, but I think we're kind of in the rarefied world still of people that are doing this. 80% of the people are not doing this. They don't track anything. And we introduce them in a gentle way to some data. And, there is data overwhelm and overload. So we try to meet people where they're at, but it's so key. I mean, I think this is the main reason why Western medicine has failed at managing or reversing chronic disease is because, we're trying to use the same trick for every patient and it doesn't work that way.
Just thinking back to, you were talking about the evolution, the journey, getting to this place where you've kind of perfected the value proposition and really it's ready to scale up in a meaningful way. We kind of talked a little bit about COVID and just like culture and influences. Like, is there anything else you attribute, like what resonated or maybe what wasn't resonating previously? Because when you just think about this broader longevity space, right? It was quantified self, and then it was biohacking, and then it was, longevity clinics. And there's all these things that, was that the right word to reach the most amount of people, or was that perceived the wrong way? Or what type of education went into really informing people what you're trying to do? And then was there something that just clicked and you were like, oh, we found the thing and like now are able to run with it in a meaningful way?
Yeah. So you're absolutely right. There's all these terms like biohacking and longevity and, quantified stuff, like you said. And whenever you use a term like that, and it resonates for people, and then everyone starts to make everything kind of fit that term, the term kind of gets bastardized and turned into something that it's not anymore. And we're seeing that with the term longevity now as well, right? Like you have people that are shouting from the rooftops they're going to live to be 210 or live forever and don't die and all these things. And that's, we're trying to always redefine longevity into our definition. So what really clicked for us is this infographic that I created after talking to hundreds of patients about what we're doing at NextHealth. This infographic is a wheel. There's 12 aspects to the wheel divided into 4 categories, and it's the 4 verticals I talked to you about. And when we paint the picture of a longevity journey using the 12 aspects of the wheel, and we're going to take you through first lifestyle medicine, then we're going to take you to preventative medicine, then functional medicine, then longevity medicine in this pathway. People really get it. It really clicks for them. And it also scratches that itch of like, oh, this is the unified model of all these different things I've been hearing about from all these different sources. And this is going to bring it together for me. Oh, and by the way, I have a doctor curating this for me that's really going to watch all of my tests. And I think that's what really resonates when people hear about how we're doing things, because it relieves a lot of the burden of trying to figure this all out for yourself. It's really hard to figure this out for yourself, and I think that's kind of where we found some success in our membership model, is painting that picture of that journey for people.
Yeah, this idea of like the terminology is interesting too, because then you almost have it on the other side, which is like, where does prevention or the optimization sit in the spectrum of like wellness versus healthcare? And we talked about like the limitations of traditional healthcare, right? It wasn't necessarily built for you to be, your best optimized self. But then kind of on the lower end of the spectrum, like wellness, anything can be wellness, anything can be bucketed into wellness. Is there that also another challenge in saying like this is both legitimate but not maybe traditional healthcare in the way that people think about it?
The way I talk about that, Joe, is I say, I lived in the Western medicine world for 25 years. I was a surgeon. I did trauma surgery. I did reconstructive surgery. I took care of people in the ICU in the emergency room. And what's incredible about the Western medicine system, and I worked at the Mayo Clinic, one of the most advanced hospitals in the world, you have incredible technologies there. Technologies that took decades to develop and trillions of dollars of research to develop. All of the technology is too much too late, right? And so what we do is we're taking that technology, whether it be MRI diagnostics, whether it be the plasma exchange machine, hyperbaric oxygen therapy, and we're bringing it forward 30 to 40 years in your life when it can actually keep you well versus trying to reverse sickness, right? And so that's how I kind of explain this decoupling of health versus disease care, but legitimize the healthcare by saying we're still using the same technology that Western medicine has developed. We're just bringing it forward in your life 30 years. So you use it when you can actually use it to keep you healthy versus reverse sickness.
All these things that you're mentioning, even hyperbaric oxygen chamber or the blood treatments or peptides, like you said, like all of this has been studied in some ways, conceived of within traditional healthcare, but there's still this tendency for it to be demonized, like in a way that like it's not legitimate. And that's where you kind of get this tension of like, oh no, the system is like, it actually doesn't want people to get healthier. It wants them to be sick. It benefits when there's these like chronic conditions that they treat over time, things like that. Maybe Dick, do you have a sense of like what is driving that? Like ultimately, like what people are trying to do, and I'll just speak for myself, is like, oh, I look and I see this thing is like, oh, this could meaningfully make me more healthy. And like, yes, it's maybe my doctor's not recommending it, like my PCP or, somebody at the hospital, but doctors like yourself are recommending it and have been studying it. And I even go a step further of like trying to validate it myself and say, oh, you know what? Like it is a good idea to integrate sauna or hyperbaric oxygen chamber or some of these things, peptides. I just had an injury that I was using peptides to recover with. It's like, I'm just trying to make the best choice for myself to be healthier. Like, why does that tension exist in a way that like I'm potentially like, doing something dangerous because I'm trying to be healthier? And now, fortunately, there are clinics and solutions that are making it more mainstream. But yeah, like where does that come from in your perspective, and like how do we get past that?
I think, we're in this particular phase of history in medicine right now, right? So prior to this phase, you had very few interventions about 100 years ago. People were dying in the streets all the time, right? And everything was very random. There was no real science applied. And then antibiotics were discovered. And finally, we had a tool to make people healthy. And companies developed after that, companies that were making medicines for other things, other antibiotics, et cetera. And during that time period, what happened was the government commissioned a report called the Flexner Report. This set the tone for the future of medicine for the next 80 years. This was back in the 50s, okay? And this report said that every intervention that is taught in medical school needs to have a scientific basis to it based on real science. And what happened was for from then until now, until this moment right now, every medical student, every doctor in the country, you could not get a degree to practice medicine unless you had this belief in your head that everything needed to have a randomized controlled trial to prove its efficacy. And what that did was that skyrocketed medical innovation, right? Because now companies can make drugs that once they proved it with a randomized controlled trial, they could sell billions, now even trillions of dollars worth of drugs, okay? And so we are where we are right now because of this. It's an incredible time. We have so much technology. We have so many incredible medicines because of this. Thank God all that happened. The pendulum is now swinging the other way, right? We've reached the limits of what that thought process could bring to humanity. How do we know we reached the limit? We have an incredible amount of chronic disease out there that cannot be solved. We keep throwing money at Alzheimer's disease, developing billion-dollar drugs and wasting it because we can't solve it. So we know we've reached the limit. And now the mentality is swinging into oh, maybe we should look at root causes. Maybe we should keep ourselves well rather than trying to just be blind and get to sickness and then try to reverse illness. It's not working. And so you see the pendulum swinging the other way. And I think we're going to reach a happy medium in the next 20 to 30 years where all of this will all come together in a unified model of health and wellness.
This episode of the Fitt Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, EGYM's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, EGYM equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of EGYM's ecosystem at egym.com. Yeah, I appreciate you walking us through that. I think it's super valuable to have articulated in that way because I think there are a lot of people that have that sense of like, we need to shift our approach and like, how did this happen? Why are they the way that they are right now? And really just getting back to this place of like, can we solve this? Can we solve it with lifestyle interventions? Can we solve it with kind of consistent habit change? And yes, there are a number of things that can support that along the way, but just continuing to kind of like treat and medicate, like it's just proven to like not be working.
And that's why Next Health kind of sits in that intersection between Western medicine and the wellness world, which we need something in the intersection because it needs to have basis in science, but also take people when they're not sick yet, right? And so, or really, really sick, And so I think that's why Next Health is perfectly positioned to be a catalyst in this new thought process around health, wellness, medicine.
Changing gears a little bit to think about expansion and how that's going. Maybe how many, I think you mentioned it, but remind us how many locations there are now, how you are like plotting this expansion, if there's any territories or states that you're specifically looking at and how you see it rolling out.
Yeah. So we have 10 locations right now. 8 of them are corporate and 2 of them are franchise locations. And a little bit of my history was I grew up in a family of franchisees. My parents franchised some concepts. And I remember as a child going to these franchise conventions with my parents and thinking, wow, look at this, all these people here, this franchise convention, just learning how to operate a business really, really well with this model that we know works. This is awesome. Fast forward, like, I'm a doctor, I open a clinic and I opened a surgical clinic where I do surgery. And I kind of forgot about all that. And then I opened Next Health 10 years ago. By the way, I opened Next Health because I had my own health struggles and I reversed my own chronic diseases. And so I was like, this is the kind of medicine that I want to practice is to reverse chronic disease. And so I opened this little clinic and it took off and started doing well. And I was like, this is fantastic. So I kept getting pressure to open more clinics. Now, it's expensive to open clinics. I got approached many times. I want to just do this on the internet. And I'm like, no, I need a place where I can have patients come and use the therapeutics and meet the doctor face to face. So after opening up 5 corporate owned locations, I just realized it's too expensive and it's too slow to do this on my own. And I remembered those franchise conventions I went to as a child. I was like, I know a model that could really work for this. About a year ago now, we launched our franchise. We filed for an FTD, which is a legal document you need to start a franchise. And we got a tremendous amount of interest. And we found some incredible franchisees that really believe not just in the business, but also in our mission of completely changing healthcare. And we opened our first franchise location, believe it or not, in Nashville, Tennessee, where people thought that we were crazy. They're like, you need to open in Miami, not in Nashville. But guess what? Nashville took off like a rocket ship, and it's still doing extremely well. And so the franchise model, we opened a few more locations since then, Chicago, Montecito. We're opening soon in Newport Beach and Calabasas, California. Just they're all over now, and it's a really great business model for something like this, where you need it everywhere, but it's really slow to do it yourself. And so I love the franchise model. I'm really happy we went that way. We're still going to open up corporate locations, but I think we're going to slow down on that. I think we'll probably max out at 10 corporate locations, and we're planning on 140 franchise locations.
Certainly the franchise makes a lot of sense, and scaling, and then getting to these kind of like different markets from, you mentioned Nashville to Montecito, like all across the board. There's of course like an added level of this being the need for oversight, the medical interventions, things like that. Most people that I've talked to on this show, when it comes to franchises, is maybe like a quick serve, healthy, better for you restaurant, or something like a gym, gyms and studios. How does this franchise for Next Health, in terms of vetting, in terms of who you're able to accept, and in terms of that level of oversight, differ from what people might think of as like a traditional franchise?
Yeah, Joe, we're probably the most complicated franchise out there out of all the franchises. One of the most complicated. And you're right. It's not stamp out type of model as much as like a Dunkin' Donuts would be, right? But we thought of that about that very intentionally, where there's certain things you can stamp out: the look and the feel, the customer service, training. Those things need to be very, very consistent. Medical oversight is always going to be the most complex part of this. And so we make sure every franchise location has partnered with an excellent doctor who is focused on safety, who is focused on patient satisfaction, and who's also very hands on and involved. And we have incredible amounts of training for that piece of the business. And we have a scientific advisory board. And then we have a franchise team of 20 people that literally go from franchise to franchise to franchise training. And then they then repeat the circuit on a quarterly basis to make sure everyone is staying up to par as well. So it's complex. It's not easy, but it works so far. I really have high hopes that like this is the right model, because in all of medicine, like we think of medicine as very risky, as very fraught with complications and stuff. And that's true in the Western medicine world because you're dealing with sick people. When you're trying to keep healthy people healthy, it's a little bit less risky and a little bit more consistent as far as what you can achieve. And so I think it's like this perfect intersection for a franchise model to come into medicine with.
One of the questions I was previously asking when I was talking to folks who were kind of in the preventative health or longevity clinics, things like that, was like this question around medical oversight and like how do you ensure the quality of care, and maybe a step beyond that, like how do you get the talent, right, the doctors to come and work at these facilities or concepts. And after talking to enough people, that I heard maybe like the third, fourth time somebody say, you know what, I spent 30 years in the ER room. I spent 25 years in surgery. I was a neuroscientist. I left that to start this. I left that to come work at this clinic. And then that kind of trickle down of like the people who work in traditional healthcare, like they're burnout. They don't necessarily believe in the system anymore. They want to come work at a place that is practicing preventative healthcare and things like that. Yeah, I'm sure this is, now that I teed it up, but like, is that what you're seeing in terms of whether it's attracting talent or partnering with people, or the interest in delivering this type of care, like from other healthcare medical professionals?
Yeah. And I'll tell you my personal story because this is exactly why I'm in it. Okay. So I ran a chain of surgery centers. We had 5 surgery centers. And we're doing surgery, right? We're putting people to sleep, we're cutting them open, we're putting them back together, waking them up. That is probably the riskiest thing you can do in outpatient medical world, right? It's extremely stressful. There's always problems, right? And there's a lot of burnout because you have to spend a lot of time and energy just stressing to make sure nothing goes wrong, right? And for me, going into this health optimization longevity space was, number one, is a lot less risky because you're helping healthy people become healthier and you're reversing chronic disease. Number two, operating a Next Health clinic is a lot less stressful than operating a surgery center, right? And these are the things that you're hearing. Like, you go from being in a high stress, high liability situation and working in an emergency room to something where people are always happy. People are that they're getting better. If they're not getting better in one thing, you try something else. It's just so great of an environment for a doctor to practice in. And I'm in this group called Longevity Doctors, which is a group of almost 500 doctors that have switched their careers from traditional medicine to this type of medicine. Remember, longevity medicine doesn't like, there's no training that happens in medical school for this, right? There's no like, it's something that you learn on your own and then you become really good at it. And now there are certification programs in it, but it's all brand new. But yeah, you do find a lot of physicians that have transitioned from a high stress, one of these environments that you end up having a lot of potential issues to longevity medicine because just of this. And it completely eliminates the burnout. I was totally burnt out. And now I'm passionate again about what I'm doing. And that's what you find in a lot of these doctors do is you find the most passionate doctors because they're like, finally, I'm doing something I love, kind of a attitude about it.
Certainly, like the demand for and the opportunity and franchising is strong. There's also now, just with this tailwinds, whether it's hotels or retreats or gyms, like office buildings, like really everybody saying like, can we integrate this? Should this be part of the services that we're offering? Like, what does that look like? How do you think about those opportunities? Are you already kind of like taking advantage of some of these other ways to plug into besides just like the franchises themselves?
We've looked at them. We actually have a location inside the Four Seasons Maui that does really well before we started the franchise model. And we're always evaluating opportunities, Joe. I wouldn't say that we are closed off to it, but one thing you will realize that once you pick a model like the franchise model is that you really need to stay hyper focused on making it perfect. You have a responsibility to the franchisees to give them something that really works. And if you lose focus, you lose that drive to continually do 1% improvements every single day to make things iteratively better and better and better, right? And so we're really just trying to stay hyper focused on what we're doing right now so that we can deliver a product to our franchisees and therefore to the patients and therefore to the world that is at a very, very high level what they were looking for.
One of those things that obviously franchisees are looking for, and you're doing this for the corporate locations as well, is driving members, like marketing, getting the word out. Of course, there is this like word of mouth aspect, and there is just like the demand and interest overall. But what have been some of the kind of successful ways that you're using to reach people? What are people kind of those experiences like when they are coming and becoming members, and how do you just like keep that flywheel going?
Marketing is really tough in this business because you have to be very careful about where you spend your resources. And when I say that is we started this business with like zero marketing budget and we ran it for almost 10 years with a very, very slim to none marketing budget. Like when I say none, I mean we spend $5,000 total per month on Google plus Facebook for a long time. Now, when you're coming into new markets, like for example, Nashville, Tennessee, people don't really know us from California, right? And we have an office in New York. So you have to get the word out there. And performance marketing is something that we've looked into. We're doing right now to create some awareness. But I'll tell you, nothing works better than number one, word of mouth. Number two is also the thought leadership aspect of this. I am out there constantly speaking to audiences all over the world. You should see my travel schedule and make you go crazy. My assistant goes crazy looking at it. I'm also on podcasts like this one. I'm writing a book. I have my own podcast. I think the more you can tell the story and more people can get kind of the long form of what you're doing, it's just so much more valuable. And I'm really focused on that. I'm just out there telling the story. We're taking really good care of our patients. We're making sure that they have something positive to tell their friends and family. And I believe that's where it's at. One more thing on that, too, I will say, I think another powerful form of marketing that we tend to forget sometimes in this world of internet based marketing is the power of local community, right? And I think we have an advantage that we are opening four wall locations in these communities. We have a place for people to go. And we're really leaning into that, forming communities in a local, hyper local fashion with our memberships and getting them together and doing events and having thought leadership type of presentations for them in those environments as well. Because I think that's really powerful. People are searching for community again.
Whether it's this kind of like 10-year journey or the expansion, how are you thinking about financing it? Whether it's taking outside venture capital, whether it's doing it kind of like whether business is profitable, and to the extent that you're, willing to talk about metrics like that, like it's not cheap, right? It's capital intensive to do things like this. Certainly the franchise model lends to being able to scale, but still, especially if you're opening like additional corporate locations, what all goes into it?
Yeah. So we have raised a Series A, and so we've raised $20 million, and we are being very mindful of preserving those resources for as long as possible. I would say the franchise model is a lot better of a scale model because you have individual franchisees investing in their location. What's beautiful about our franchise model is that each one of our locations does the same amount of revenue as maybe 5 or 6 other franchise concepts. So if you're putting your time and energy into opening a franchise and you're looking at it as a franchisee, if you can make 10x the revenue of opening maybe, I don't know, a Dunkin' Donuts or something with one of our stores, and you're still making the same and EBITDA margins or better, why not do this instead? Right now, you have to have a little bit of a strong gut because literally, because it is medicine, it is medical. There is a lot more oversight. There's a lot more training and hurdles you have to overcome. But if you have the ability, and what we find is a lot of our franchisees are super passionate about longevity because either they've had their own longevity journey or health journey, and they really believe in what we're doing. That passion combined with their resources, we can really scale a lot faster in this way. And that's why we chose a franchise model. I think we're done raising capital for a long time until some other big, um, you know, opportunity comes along for us to scale. We have over 100 locations signed up for, so committed by franchisees. But I think by the end of this year, we'll have 20 locations open.
In addition to getting those places signed and opened, what else should we look out for? What are you looking forward to? And selfishly, what should we be looking forward to Fit Insider that, maybe news or developments that we would cover, that people would be interested in?
So Joe, we are always staying cutting edge. That's my another one of my jobs is I lead the science at Next Health. We are bringing in some really cool stuff into our locations. You probably already know that we have plasma exchange at all of our locations, and we do this at a very, very high level. And so that's an incredibly powerful technique that we're using on our patients that we're scaling, which means we're trying to drive the price lower as well. We're bringing in some mental health therapeutics as well. We're bringing in some proven technologies in managing heart disease and blood pressure as well. So, really cool technology. Me personally, I'm writing a book now, and I just got bought by Simon Schuster as of today. I found out, so that was
Wow,
awesome news
congrats.
for me. Yeah, so my podcast Extend is growing really well, and I'm really excited about that. And some of the guests we have on, really trying to bring really good science to people in an easily understandable and digestible fashion is kind of my goal for the podcast. And yeah, I mean, I think look out for some more technology on our front as far as like patient facing dashboards and things like that people can really use to interact with their own health as well.
And then for anyone that wants to learn more, come get signed up. Website, social, what's the best place for them to do so?
Yeah, so Next Health's website is www.next-health.com. And then we also have the same social. And my personal social is at Darshan Shah, MD. And drshaw.com is my website.
Perfect. We will have everything linked up, easy to find in the show notes. Excited to share this conversation, and certainly we'll be following along. Like I said, as you continue to open up new locations, add new technology, and yeah, just continue to kind of push the envelope of what's happening in the space.
Yeah, and if any of your listeners are interested in opening a franchise location, we'd love to talk to them. Give us a call at Next Health or reach out to us on our website.
For sure, we'll add that to the franchise opportunity and direct people there. And just super grateful for the time today. Appreciate you spending some time with us.
Thank you so much, Joe.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.